hearing the applicant's modification request today. So this public hearing before the Health Systems Planning Unit, identified by docket number 19-32238 MDF, is being held on February 16, 2021, regarding a modification request filed by the applicants, Western Connecticut Health Network and Health Quest Systems, collectively Nuvance Health, on November 8th of 2019. On March 14 of 2020, Governor Ned Lamont issued Executive Order 7B, which in relevant part suspended in-person open meeting requirements. And that executive order has been extended through April 20th of 2021. To ensure continuity of operations while maintaining the necessary social distance to avoid the spread of COVID-19, the Office of Health Strategy, or OHS, is holding this hearing remotely. We ask that all members of the public mute their devices that they are using to access the hearing and silence any additional devices that are around them. This public hearing arises out of an application for a certificate of need approval pursuant to Connecticut General Statutes Section 19A 639A, and will be conducted as a contested case in accordance with the provisions of Chapter 54 of the Connecticut General Statutes. Again, my name is Michaela Mitchell. Victoria Veltri, the Executive Director of the Office of Health Strategy, has designated me as the hearing officer for this matter. Also in attendance are my colleagues Brian Carney, who is the team lead for the CON program, and Orman Clark, who has been working on compliance and is also one of our healthcare analysts in this matter. Our priority is the integrity and transparency of the process. Accordingly, decorum must be maintained by all present during these proceedings. I just want to advise everyone that this hearing is being recorded and will be transcribed by BCT Recording LLC. All documents related to the hearing have been or will be uploaded to the CON portal for public review, and that is accessible on OHS's CON webpage. Nuvance Health is a party to this proceeding. At this time, I'm going to read into the record those documents appearing in the planning unit's table of record. All of them have been identified and shared with the applicant's counsel. I think that there were there was one thing that was omitted, and I think it was the pre-filed testimony. I'm going to ask attorneys for the applicant to just state their name for the record and then indicate whether or not there's any objection to the table of record that was emailed to your email accounts this morning.
Hi, this is Lisa Boyle. I represent Nuvance and Sharon Hospital. I have no objection to the statement of the record other than the addition of the pre-filed testimony, which you mentioned. Thank you.
And good morning, Connor Duffy of Robinson and Cole, also representing the applicant, Nuvance Health and Sharon Hospital. Thanks.
Thank you both. All right, so in terms of the order, the applicants are going to present their direct testimony. HSP will ask questions of the applicant, and then we'll hear from the public. I reserve the right to allow public officials and members of the public to testify outside of the order of the agenda. For those who weren't able to pre-register in that 9 to 10 o'clock hour, just hold tight. I will make sure that I hear your comment. And then I'll also make announcements when we go into the public commentary about how to submit any written comments if that is what you wish to do. I'd like to advise the applicants that we may ask questions related to your modification that you may feel that you have already addressed in your request and in your pre-filed testimony. I'm going to do this just for the purpose of ensuring that the public has knowledge about the request, and it may also be for the purpose of clarification. As the hearing is being held virtually, we ask that all participants, to the extent possible, enable use of video cameras when testifying or commenting during the proceedings. Anyone who is not testifying or commenting must mute their electronic devices, including telephones, televisions, and other devices not being used to access the hearing to avoid disruption of the hearing. We're going to monitor to the best that we can the participants during the hearing. To the extent possible, counsel for the party should raise hands to make any objection or to facilitate raising a point during the hearing. If the hand raise function is not immediately recognized by myself or by Mr. Carney, you can unmute yourself and just state what you'd like to state on the record, and I'll acknowledge you. When we go off the record, this is very important. We don't like to stop recording the hearing because this is a virtual space. We want to make sure that we don't miss any parts of the hearing that are pertinent to making the decision. So we don't like to stop the recording. So if you need to go off the record, you have a conversation that you don't want recorded, make sure you mute your device. Otherwise, it may be captured on the recording. It may be transcribed. So just be very careful about that. Whenever we go off the record, I'll make sure that I give a 1-minute warning to the parties and to the public to let you know that we're coming back on the record so that you can get back to your computer and get settled in and be prepared to listen or to participate. At this time, I'm going to ask, I believe it's just Dr. Herco and Dr. Cantel. I'm going to ask Dr. Herco and Dr. Cantel to raise their right hand so that I can swear them in. I see Dr. Herco. I'm just kind of looking.
I'm here. I just want to, I'm
There you
just a
go.
point of clarification. I am not a doctor.
Got it. Thank you. All right. Do you solemnly swear or affirm that the testimony that you are about to give will be the truth, the whole truth, and nothing but the truth, so help you God? Dr. Herco?
I do.
And Mr. Cantel?
I do.
All right, perfect. Thank you so much. So at this time, I'm going to turn it over to the applicants. For people testifying, just make sure that you state your full name and adopt any written testimony you've submitted. And we will go ahead and get started. Make sure for those of you who are listening that your electronic devices remain muted. Turn it over to counsel for the applicant.
Thank you, Hearing Officer Mitchell and the Office of Health Strategy staff. Thank you for allowing us to provide our testimony today and ask that you grant the request for modification. Just a few things. My name is Lisa Boyle. My colleague is Connor Duffy. We represent New Vance Health and Sharon Hospital. Today, you'll hear testimony from Mark Herco, who is the president of Sharon Hospital, and Rick Cantelli, who's the board chair for Sharon Hospital, and they will express why it's important that this modification be granted. The modification request is really straightforward to align the governance requirements imposed on Sharon Hospital with the requirements that are imposed on other hospitals in the state. Sharon Hospital has and will continue to be a community board. There is nothing in this modification request that will change that. The board will remain a community board. And with that, I ask that you hear the testimony of Mark Herco, who's the president of the hospital. Thank you.
Thank you. Thank you, Hearing Officer Mitchell and the staff of the Office of Health Strategy for allowing me to testify. My name is Mark Herco, and I am the president of Sharon Hospital, and I adopt my pre-filed testimony for the record. And I am today testifying on behalf of New Vance Health and Sharon Hospital in support of the modification request filed for condition number 2 of the agreed settlement entered into with OHS in this matter. As a point of background, I actually grew up in Ohio. I am a physician and a surgeon who went to medical school in Ohio. All my training was in Ohio, except where I did vascular surgery training at Loyola University in Chicago. I then started my professional career in Ohio itself, spent 11 years at University Hospital, Western Reserve Care System. And then over the years, took on and graduated responsibility positions leading up to chief and chair of surgery at Barnabas Health. And then most recently in 2017, accepted a position as a assistant vice president of then was HealthQuest. In regard to surgical services, we helped create the ACGME training programs throughout the New York side of our combined health system. And over a period of 2 years with graduated increase in responsibility, then applied for the position as a president of Sharon Hospital, which I was named in mid-November 2019 and assumed the role in December of 2019. Regarding my time as president, particularly community engagement, since becoming president, we only had about 2 months pre-COVID. And with that, my goal and our leadership team's goal at that time was to really establish strong lines of communication and transparency. And this was with one-on-one and group meetings, both in my office and outreach throughout the community through various community groups, chambers of commerce, EMT, EMS, our private schools, and really went out to the community. And once COVID came into being, everything went into a Zoom mode, and our outreach, particularly with the Save Sharon group, was pretty much carried through in that manner. As a point that I actually came to really come to understand in great detail was that Sharon Hospital, although being in Sharon, Connecticut, is actually a central point in a large region where about only 7% of Sharon Hospital's discharges are from residents of Sharon itself. And actually, our patients come from 3 states. And we actually looked up, and it's approximately 144 unique zip codes where they hail from. So this is really a regional type of a facility. Some of the community initiatives that we had worked through, including we had COVID partnerships with the schools in regards to testing. We actually worked with our board members regarding outreach, setting up meal trains for the employees, recognizing the hard work and efforts that they had entertained. We working with philanthropy, which was something that when this hospital was a for-profit entity years ago, there really was a hiatus on philanthropy. And just in a matter of a year, with a $1 million challenge grant, which was offered to the community, we were able to meet those goals and really utilizing our relationships with the various members of the community, our political personnel, our senior leadership team, and our board. We really came together, and the proof is we hit that target in only 8.5 months, and really proud of that effort. Since then, I've really come to rely and come to really appreciate just the magnitude of how well the board has functioned in my 1 year and in the few years that we have been part of the system. They're a varied group of people with multitude of pretty much I should say a melting pot of what all the communities stand for in this region, from industrialized farming, philanthropy, physicians, nurses, banking, investment, private business, you name it. Every member of the board has their niche, and they really have offered help and guidance, and they really, I really am honored and comforted in that they feel free to call me at any time, and they really have. Just even over the weekend, I received a few calls regarding some issues with the COVID vaccine and questions that they had. And they've really helped with decision making, particularly when we're looking to partner with the schools and looking for emergency space if we were going to be overwhelmed with patients during the first wave of COVID. They helped initiate relationships with even the Safe Sharon group and other groups in the community to develop the meal train, whereupon we were able to provide meals to our employees, give them a healthy respite with all the hard work they've been putting in, and even some food donations to the community, our Christmas gift giving tree that we have. Just really been honored with how well they have really worked with us. And they really are members of the community and proud members of the community, and let us know, and believe me, they let me know if there's something that maybe I need to back off on, or something that we as New Vans Health need to really think about as we move forward, because they really are invested and are living in the communities that we work in right now. So that really has been just a welcome type of activity that I've seen. And with these findings, it really, I ask that the modification should be granted, and our request to modify Condition 2 is really necessary to address changed circumstances, and really to align this with what is really in place for Danbury Hospital, Norwalk Hospital, and other hospitals in our state. I ask for your approval of this straightforward clarification of Condition 2, and I'll be happy to answer any questions that you may have. Thank you.
All right, thank you, Dr. Herco.
Okay, I think I'm up next. Thank you, Hearing Officer Mitchell and the staff of the Office of Health Strategy, for allowing me to testify today. My name is Rick Cantelli, and I'm the chair of the board of Sharon Hospital. I adopt my pre-filed testimony for the record, and I'm testifying today on behalf of New Vans Health and Sharon Hospital in support of the modification request filed to Condition Number 2 of the agreed settlement entered into with OHS in this matter. In addition to my pre-filed testimony, I prepared some remarks that I hope will provide some perspective or some context around that pre-filed testimony. First, a little background. I've been a lifelong member of this community. I went to elementary school and high school locally, and after graduating from college in 1981, I started my career as a teller at a local community bank. I initially took the job because I thought it would be good for my resume as I looked for my real job, most likely in New York City, as I had a degree in finance and had envisioned a career maybe on Wall Street. I quickly realized that I loved community banking. You really could help make a difference in people's lives by helping them buy their first home, help them save for college, or even start a business. I also recognized that this area was a great place to raise a family. There was a fantastic quality of life where everyone looked out for each other and for everyone else's kids. In fact, your social life often revolved around your kids' athletic activities. And while there are financial trade-offs, those things, that sense of community and of being able to make a difference, were more important to me than just about anything else. So 40 years later, I'm still at the bank, and I'm as president and CEO. As a community banker, you're often asked to serve on local boards, and I've served on many over my career. And when I was asked in 2017 to be considered for the Sharon Hospital Board, I was both honored and eager to do so. I'd watched from afar as the hospital went through several organizational and ownership changes. And as my kids were born there, and we have frequented the hospital emergency room and have had many procedures there over the years, I realized just how important the hospital is, not only to my family, but to the entire community that it serves. I thought that being a member of the board would allow me to educate myself about healthcare in our rural area and hopefully contribute in a way that would ensure the stability and longevity of the hospital. So as I became educated about healthcare generally and Sharon Hospital specifically, our primary responsibilities as a board became clearer. We were to ensure that professional standards and a high quality of care and safety are present at Sharon Hospital. We were responsible to oversee and approve the granting of or revocation of medical staff privileges. We were to periodically review and assess the health needs of our communities. And we also were to be representatives of all the communities served by Sharon Hospital. These specific responsibilities are consistent with broader governance responsibilities to exercise reasonable business judgment and do what is in the best interest of the hospital and its stakeholders. I mention this because it provides a background and context for how board members have and will continue to be selected. First, it should be noted that OHS and the independent monitor have agreed that the Sharon Hospital Board constitutes a community board. Second, it should be noted that of the current roster of the 12 community members of the board, 8 of us remain from the original FCH appointed board. And third, as noted in the modification request, nothing will change to reduce community representation or change the composition of the board. We have a nominating committee of the board that seeks out board members, taking into consideration the needs of the board, including the skill sets necessary to effectively carry out our fiduciary responsibilities, geographical needs to ensure coverage of Sharon's entire catchment area, backgrounds, experience levels, and other relevant factors that will enhance the board's ability to effectively discharge its responsibilities. The nominating committee serves an important purpose and has been extremely effective in the following ways. If one were to review the current composition of the Sharon Hospital Board and the associated bios, it is unequivocal that it meets the definition of a community board in every sense of the phrase. Board members recently nominated by the committee have served to strengthen the board in all of the above critical areas. The nominating committee and the board are open to recommendations and ideas about the hospital, including potential board and committee membership. But we cannot and should not vest a particular group in any one subset of the broader community that may have a heightened ability to influence board or committee appointments. My appointment as chair of the board came weeks after the appointment of Dr. Herco as president of Sharon Hospital and just weeks before the onset of the pandemic. It is a gross understatement to say that it was a challenging environment to initiate this new leadership structure. But Dr. Herco, despite being new to his role and thrust into the ensuing chaos during the early stages of the pandemic, worked diligently to engage constructively with members of Save Sharon Hospital, as he described earlier. In the early days of the pandemic, the Save Sharon Hospital group also worked alongside members of the board's Community Relations Committee to organize support for the heroic work of the staff of Sharon Hospital and organize food drives and other acts of public support for those essential workers. As Dr. Herco mentioned, he and I engaged in several virtual meetings and email correspondence with the Save Sharon Hospital group to address their concerns as we would with any other group. Unfortunately, towards the end of 2020, it became clear to me that we hadn't made the positive progress that I thought we had, and it seemed like we were right back where we started from in terms of what the group was looking for. So at this point and in closing, I'd like to say that as a CEO and board member of a publicly traded company, I clearly understand the need for effective governance within an integrated system such as Nuvance in order to provide for consistency and uniformity while simultaneously providing for local representation and authority. This modification request is simply a request that Sharon Hospital's governance be treated consistent with Danbury and Norwalk hospitals in other recent CON agreed settlements. So given the change in circumstances relative to the termination of the FCH agreement and the robust community representation within the board now and into the future, I respectfully ask for your approval of this straightforward clarification. Thank you for your time.
Thanks, Mr. Cantelli. I did receive notification that Representative Horn would like to make a statement. I'm going to defer to attorneys Duffy and Boyle just in case there's anything additional that they wanted to present prior to that.
Hearing Officer Mitchell, if we could reserve the right to make closing remarks after the public comment, we would prefer that.
All right, sounds good. All right, so I'm going to turn it over to you, Representative Horn.
Thank you very much, and thank you, Dr. Herco and Mr. Cantelli. I really wanted to just frame the conversation today a little bit. I think this particular discussion today is really an echo of a relationship that went a little bit sour a few years ago between HealthQuest and the community, and in particular, as reflected by the a precipitous shutting down of a part of the hospital, which alarmed people in the community who are really dedicated to this precious community asset, and beyond that, it was also it wasn't just the shutting down of a particular the maternity ward. It was hostility between Health Quest, and I am talking about Health Quest, not the current management. I'll get to that in a minute. And the Foundation for Community Health, which is the reason that FCH withdrew from this relationship in the first place and caused this issue to arise. And so I think really what you'll hear from a lot of people in the community today is that this is, from my opinion, that this is probably less regulatory than it is postural, and it is about attitude and openness to the community and listening. And I will recall that many of us, I think a lot of us here today, were at the hearing in Danbury some years ago on the merger before this CON was developed. And we in particular heard the testimony of Dr. Murphy, and many of us thought, wow, what he is doing in that community and his relationship with the communities of Western Connecticut seems like a really positive thing. And I know that certainly the head of FCH changed her testimony to say, if we could just do what you're doing there, that would be a huge improvement. And I think, and then I just want to say that I do think that we have taken huge steps in that direction. And I want to thank Dr. Herco in particular, who is always available to me when I've reached out to him, particularly in this crucial moment of, we are all aware of, the great pressures that our hospitals are under right now in the pandemic. And I think no one really wants to increase that, but the hospital is important to people in the community. And I think we want to be part of its success. So I just really want to thank everyone who has chosen to dedicate so much of their time to this institution, and that includes people on all sides of the issue in front of us today, for taking the time out to dedicate themselves. And I really look forward to more of those public-facing, outward-facing conversations with the community that can engage everyone in its success. And again, I thank you for being here, and I thank you for allowing me to share a few words this morning.
Thank you, Representative Horn. Are there any other public officials or legislators that are here that want to make a statement? If so, you can unmute yourself.
I'm Curtis Rand, First Selectman in Salisbury. I just want to thank you for letting us listen in on this and educate ourselves a little more about it. That's all.
Thank you. All right. So at this time, I'm just going to circle back before we go to HSP's questions. I'm going to circle back with counsel for the applicants and just double check and make sure there's nothing else that you want to add prior to us asking questions and then going to public comment. Everyone's quiet. Attorney Boyle.
Yeah, just a few things. I think some of the points have been made by our witnesses and certainly in our filings. This really is a very straightforward modification request. We have a situation now where there is a changed circumstance that prevents the actual condition 2 from being able to be performed as is. And what we're requesting is a modest modification to allow for the provision to actually look like what everyone else in the state has. Basically what Norwalk has, what Danbury has, and what the other hospitals in the state have. I think this is also an issue of corporate governance. Specifically, we have a board that is composed of community members who have fiduciary duties by law to fulfill in selecting people who meet the needs of the communities they serve in terms of their expertise, as I think Mark Herco and Rick Cantelli mentioned. It's a very sophisticated organization that requires different skill sets. We mentioned the farming, the banking, the finance. These are all things that are essential for a board to have in modern times, especially one of a healthcare institution. And this board of community representatives is charged with selecting the right folks who can meet those needs. What we are asking is that this board have the respect and the of this body to allow them to perform their fiduciary duties and to select folks who will act in the best interests of Sharon Hospital. And that is consistent with not only corporate law and other nonprofit boards, but also the charge of OHS in making sure that there is nothing that is imposed as a condition that is unreasonable or is an unreasonable burden on this board. It is, it is something that is fundamental to our governance, and we really can't, this is not a public corporation, it's not a political body that should have representatives of government officials serving on the board as ex officio members. And that is fundamental to our governance. And so with that, I asked, and we'll come back and we'd like to speak at the end as well, and explain to you why it's essential that this modification request gets granted. Thank you.
Thanks. Okay, so what I'm going to do is I'm going to circle back with my colleagues. I'm going to do two things. I'm just going to double check on my questions or our questions for the applicants, and then we're going to check on the list of people who pre-registered so that we can start with public comment. So we are going to go off the record, but we're still going to be recording. So just be very careful about what you say or what you do. I would really encourage people to turn their camera off if they're going to be hanging around in the background. But so we're going to go off the record for about 15 minutes. We'll come back at around 10, let's say 10:50, and we'll go back on the record. And at that time, OHS will ask questions, and then we'll go right into public comment. Thanks, everybody. All right, everyone, we're going to go back on the record in about a minute. All right, so we are back on the record. I just have a couple questions for Nuvance. I'm not sure who is the most appropriate to answer the question, but I will I'll defer to attorneys Boyle and Duffy to let me know. And if it's somebody who has not been sworn in, I'll go ahead and swear them in at that time before they respond. So the first question that I have is, I just want to be very specific about what you're asking for. I think that there was a request to revise the language of condition 2, but it looks, with regard to the Foundation for Community Health, but I think that it seemed like that maybe there was another request with that in terms of the composition of the board. And so I just want to make sure that I'm very clear about what you're asking for.
So Hearing Officer Mitchell, if I could answer that question. We're requesting that condition number 2 look like condition number 1, which is that one community representative be elected. And the reason for that is because it's consistent with what Danbury and Norwalk and the rest of the hospitals in the state have. And so that would be our request.
So you want it to look exactly like number 1, you're saying?
Yep, but with Sharon instead of Danbury and Norwalk.
What precipitated this request? And I think what I'm specifically asking is, when did the agreement between the applicant and the Foundation for Community Health, when did that terminate?
Mark, do you want to answer that question, Mark Herco?
Sure. Actually, it occurred before even I became president. So, and that's so it was sometime at the end of was it 2019?
Does anyone know the exact date?
It was like October 17 of 2019.
Great. And then the other question that I have for you is, you've talked about the board composition since the creation of Nuvance, and how you've worked together to ensure that people are well represented in the community. How do you plan to ensure that this continues?
I can at least from my part, I mean, we have a nominating committee, which is made of the board members, and we receive recommendations from people throughout the community regarding their interest or special skill set that may further enhance the board. And as a point of fact, the most recent one of the more recent members of the board that just started his term in January of this year, was a long-time serving member and former chair of FCH. So our current chair of the nominating committee was a longtime member of FCH and helped negotiate the agreement between HealthQuest and Sharon Hospital when Sharon was purchased by HealthQuest. So the representation on this nominating committee and the board itself have been very vocal and very strongly community oriented. And you could see that from where they come from: Millbrook, Sharon, Lakeview, Salisbury, Kent, Dover Plains.
Rick, do you want to add to that?
Sure. I just would like to add that the nominating committee seeks out members that provide any number of skill sets or representation that the board is missing. For instance, we try to cover geographically the entire catchment area for Sharon Hospital, but as I mentioned earlier, a couple of our main primary responsibilities as board members are the credentialing of physicians at the hospital, as well as safety and quality at the hospital. And unless you've been in this industry for a long time, there are many acronyms and definitions that I'll speak for myself as a layperson, there's a steep learning curve. So we recognize we needed, in order to effectively discharge that fiduciary responsibility, we needed to bring onto the board members that had a medical background to help explain to us and help vet these types of situations at the hospital to ensure that we were looking out for the best interests of the hospital. So I think we've added 4 members since the original FCH appointed board, and 3 of those 4 are doctors. So I think we've really strengthened our skill set in that area. And again, that was through the chairman of our nominating committee recognizing those skill sets that were needed on the board.
What additional skill sets do you look for besides geographic, location, and medical background? So
I'll jump in a little bit, but I'm answering on behalf of the chair of our nominating committee, but it could be financial, it could be a broader perspective of healthcare and the changing needs of healthcare. We try to ensure we fill in all those gaps, and really we are looking for people that sincerely care about the hospital and the services it provides for this community. So there's not a specific checklist, but those are some of the other nuanced skill sets or characteristics that we look for.
And then another question that I have is, can anybody tell me what precipitated the termination of the agreement with the Foundation for Community Health?
I think it may be the best person to actually answer this may be Carrie Eaton. And so we would have to have her sworn in.
All right. So Ms. Eaton, if you would mind raising your right hand for me when you're ready. Do you solemnly swear or affirm that the testimony that you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Perfect.
Just one thing before she responds, I just want to mention that there are confidentiality obligations in that agreement, so we will be limited in what we can actually say.
Okay. To the best of your ability, Ms. Eaton, just by way of background.
Yeah, thank you for the opportunity. I think the reason I'm being asked to answer this question is because I was a member of HealthQuest and the chief operating officer at the time that this was going on prior to the creation of Nuvance Health. I think it's important that I'm going to be general because I really wasn't a direct party to either what was going on with the foundation or the exact agreement. But what I can share is that there was an agreement between the foundation and between HealthQuest. And there was some disagreement as to how to interpret certain parts of that agreement. And there was an agreement between the parties that rather than continue that agreement, that there would be, after some negotiations, there was a decision from both parties to withdraw from the agreement altogether. I know that's not very specific, but I don't want to misstate anything inaccurately.
Hearing Officer Mitchell, John Murphy is on and also would like to add to that, if you could swear him in as well.
Okay. Mr. Murphy, if you wouldn't mind raising your right hand for me. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
Yeah, the only thing I'd like to add is that the contractual relationship with FCH was cumbersome, and it involved, I thought, a series of financial obligations that were problematic in that there was a disagreement about who owed which party how much. And it was getting in the way, I thought, of really productively looking at what does the community need and how can we deliver it. And I had the good fortune to speak to a number of members of the board of FCH who agreed. And we said, you know, the money will figure itself out. We walked away from what we had previously believed was owed us to the tune of several $100,000. And thought really just to look forward and stop the debate over who had the financial obligation to whom. And it was friendly, it was cordial, and it was, I think, mutually beneficial that we just left that behind. The board of FCH agreed with it, and it was really based upon those discussions that we decided to end that contract.
Hearing Officer Mitchell, just one thing to mention on that. The date was October 18th of 2019, not the 17th, sorry.
Thank you.
Hello? I can also just attest to that. I'm Nancy Heaton with the CEO of the Foundation for Community Health.
All right, hold on one moment, Ms. Heaton, okay? Let me just defer to attorneys Duffy and Boyle. Would you like me to swear in Ms. Heaton to make a comment on behalf of the applicants?
Yes, we're comfortable with that.
Okay. All right, Ms. Heaton, if you wouldn't mind raising your right hand for me. Do you solemnly swear or affirm that the testimony that you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
Yes,
Okay, what is your title again, Ms. Heaton?
I'm the CEO of the Foundation for Community Health.
Okay.
I just want to confirm that it is October 18th, 2019. I looked it up while we're on here. Basically when I believe that we decided that once the grant agreement was nullified, that our role in the part of the grant agreement that had us selecting the board members for the hospital, that section also became null and void, and which is why we wrote to OHS and said we no longer felt that we had that responsibility since the grant agreement had been nullified.
Thank you. Anything else, Ms. Heaton? Just another question. I think I heard, I want to say that I heard that there are still members from the FCH appointments that are on the board. I just want to confirm how many.
I believe it is board members from that were on the FCH board prior to being on the Sharon Hospital board. Is that what you're asking?
So I think that there are appointments, people who were chosen from a list of people who were recommended by the FCH.
Oh, there's 8. There's 8 of the 12 original community board members are still on the board that were originally appointed by FCH.
And then can you also tell me how many are FCH members? It was the
I
first
believe-
question you thought I asked.
Yes. So I believe there are 3.
3. What are your board terms?
They're staggered. There's a class of 2022, a class of 2023, and a class of 2024.
Anyone rolling off in 2022?
Yes, there are 3. I don't know that they're rolling off, but their term is up, and I believe I believe they can extend for another term. I'm not exactly aware of the bylaws, but I believe they can re-up for another term.
All right, and do you know about 2023 or is it too early?
There are 1, 2, 3, 4, 5 whose term ends in January of 2023. And 1, 2, 3, 4 whose term ends in 2024.
Thank you. I don't think I have any other questions. Let me just defer back to attorneys Boyle and Duffy for anything additional before we go to public comment.
Just one note, Hearing Officer Mitchell, is there's the ability to have 3 3-year terms of each board member. So they could actually, depending on when they come on, they could have a total of 9 years each.
Thank you for clarifying that.
Can I just ask, what's the total number on the board? Total members?
12, right? Rick, you're on mute. The common Zoom problem that we all have. Rick, oh, there you go. Oh, nope, you're still muted. You're still muted, sorry. Nope, there you go.
Sorry, my apologies. I think there are 12 community board members, and Dr. Herco is a board member as well, I believe.
Thank you.
Okay. Anything else from attorneys Boyle and Duffy?
Not at this time.
No. Any other questions on OHS behalf that I might have missed, Brian and Orman? No.
I'm all set. Thank you.
All right, so we are going to go ahead and move on to the public comment portion of the hearing. All participants, to the extent possible, should enable the use of video cameras when commenting during the proceedings. Anyone who is not commenting, make sure that you mute your electronic devices, including telephones, televisions, and other devices not being used during the hearing. We are going to call the names of those who have signed up to speak in the order in which they are registered. If we miss anyone, please make sure that you utilize the hand function. We'll acknowledge you and we'll make sure that you have time to speak. Before giving your comments, please state and spell your name for the purpose of accurate transcription. Speaking time is going to be limited to 3 minutes for everybody. Do not be dismayed if we stop you at the conclusion of your time. We want to make sure that we give everybody the opportunity to speak, but we also want to be fair. So if there's anything that you want to add that maybe you might not be able to verbally say, we're going to strongly encourage you to submit any written comments to OHS by email or mail no later than February 23rd of 2021. So we're going to leave the record open. We're going to adjourn the hearing today, but we'll leave the record open until February 23rd of 2021. Our email address is concomment. Oh, Leslie, are you there? I just want to make sure I got the email address.
We're using the general email address, ohs@ct.gov.
Thank you. Can you say that one more time?
ohs@ct.gov.
Thank you. Thank you so much for backing me up on that. And then our mailing address is Post Office Box 340-308 at 450 Capitol Avenue, Hartford, Connecticut, 06134-0308. One other thing I wanted to mention about public comment is, I just wanted to make sure, double check that there are no public officials or legislators that have popped in on us while we went back and asked additional questions of the applicant. Are there any public officials? You can just make sure you unmute yourself and let me know you're here. Okay. So no one. So at this time, I'm gonna go in order of which people signed up with Leslie. And the first person that we have is Mr. Herbert Moore.
Thank you. My name is Herbert Moore. I grew up in Sharon and I live in Sharon with my wife and 2 children, both of whom were delivered at Sharon Hospital. Many of my friends and relatives have depended on the Sharon Hospital when we've needed it most. I'm grateful to the staff, doctors, administration, board members, and regulators that have kept this valuable institution in our community. I became an advocate for maintaining a high quality, broad range of medical resources locally in 2018 when it was announced that the maternity unit at Sharon Hospital will be closed within 30 days. I was troubled by the reasons publicly cited by HealthQuest for this closure, and we organized with our local community and came to share our concerns at the hearing for the proposed merger between HealthQuest and Western Connecticut. We listened as the Foundation for Community Health described contributing the majority of the cash for the purchase of Sharon Hospital in 2017, only to face an onslaught of litigation by HealthQuest. This was powerful testimony that is on the record, and I would urge examiners to revisit it. The jarring announcement of the closing of maternity, the lack of sound reasoning publicly conveyed for doing so, and the paucity of meaningful two-way communication between the hospital and the community after the merger points to an issue that should be addressed. As noted by some earlier speakers, this is a unique governance condition, but nobody has mentioned the unique circumstance that led to it. The $3 million put up by FCH for HealthQuest to acquire Sharon Hospital were the direct proceeds from the sale of Sharon Hospital to a for-profit entity 2 decades prior, which were then used to start FCH. The money that HealthQuest accepted was community money that came with the condition that FCH, as a community representative, be able to nominate board members. This must be recognized as the Sharon Hospital situation is fundamentally different than that of Norwalk and Danbury hospitals. The proposed change completely removes a valid and binding mechanism for protecting community representation on the Sharon Hospital board. We have attempted to discuss an alternate mechanism to protect such representation with Nuvance. While the existing Sharon Hospital board has been generous with their time, despite the suggestion by OHS, Nuvance has been unwilling to discuss directly. I appeal to OHS. When hundreds of people from 3 states, including first selectmen and mayors, gather outside to protest the actions of a hospital, when hundreds more send letters clearly articulating their worry about the management of Sharon Hospital, when the local newspaper is filled with op-eds by respected community leaders decrying the abrupt closure of maternity, there is something that needs to be addressed. This is not a situation in which Nuvance's request to remove all outside oversight from board appointments would lead to better community relations or management of our local hospital. I urge FCH to consider our proposal and reject the proposed change to condition 2 submitted by Nuvance. Thank you.
Thank you, Mr. Moore. We're gonna go with Ms. Kathleen Friedman next.
Good morning. My name is Kathleen Friedman. I'm a member of Save Sharon Hospital and a longtime Sharon resident. I want to thank Michaela Mitchell and her team, Nuvance, Dr. Murphy, Dr. Herco, and council, and acknowledge with gratitude the steadfast commitment of Nuvance and Connecticut healthcare officials during the pandemic. I joined Save Sharon Hospital effort in 2018 to oppose the closure of the maternity service when we also feared the hospital itself was in danger. We were further disheartened to hear months later at the Danbury hearing of the precarious position the Foundation for Community Health found itself in with a breakdown in relations with HealthQuest. As someone who had received life-saving care in Sharon Hospital's ICU, and then as an inpatient battling an infection my failing immune system struggled to defeat, the prospect of a diminished Sharon Hospital was unnerving. Over many years, in consultation with clinicians in New York, Cleveland, Washington, D.C., and Sharon, I have learned the importance of a culture of open channels of communication within the hospital or medical system that supports the medical staff and extends to patients and to the broader community. Because community members are increasingly recognized and experience themselves as key stakeholders in this ecosystem, the effects of starved communication reverberate and enhanced inclusivity becomes restorative and invaluable. Sharon Hospital has recognized this value in establishing a patient family advisory council. Our request today is simple and in keeping with Sharon Hospital's innate nature. In resolving the question of Condition 2, with the departure of the Foundation for Community Health and the loss of its wealth of experience in addressing our local healthcare reality, we ask that additional community voices be added to the mix of expertise on Sharon Hospital's board and outreach committee. This comports with the Office of Health Strategy's mission to break down barriers and transform the ways we work together. Such innovation requires a multiplicity of voices. For that reason, the Affordable Care Act identified patients, families, and surrounding communities as not simply consumers, but as participants and partners. Finally, in our rapidly changing healthcare world, the inclusion of various voices is especially critical for a small community hospital such as Sharon. Such voices have been the life breath of this hospital over decades, which is why we are here today. Thank you, and thank you to Dr. Herco and Mr. Cantelli for the meetings and exchanges of ideas over many months around this issue.
Thank you, Ms. Friedman.
Thank you.
Nicholas Moore.
Good morning. My name is Nicholas Moore. Thank you, Hearing Officer Mitchell. Thank you, Dr. Herco, and thank you, Rick Cantelli, for your dedication during perilous times. And thank you, Representative Horn, for your helpful framing of this discussion. I come from a medical family. Our youngest child was born at Sharon Hospital 33 years ago, as well as two of my grandchildren. I joined Save Sharon Hospital when HealthQuest attempted to close maternity in 2018. The Foundation for Community Health, aka FCH, is dedicated to improving the health and well-being of the residents of the Greater Harlem Valley in New York and the Northern Litchfield Hills in Connecticut. I attended the HealthQuest Western Connecticut Health Network merger hearing in Danbury on December 4, 2018, where we learned of the schism between soon-to-be Nuvance and FCH. Next came the November 18, 2019 request for a revision to condition number 2, which would excise FCH from a nominating role in advancing community members to the Sharon Hospital Board. This could result in a self-perpetuating, inwardly facing board, lacking in the perspectives and connections of FCH, to the detriment of the communities served by Sharon Hospital. It would also represent in self-perpetuating committees, like the Community Outreach Committee. When we submitted a specific proposal regarding condition number 2, OHS suggested that we speak with Nuvance to see if we could reach an agreement about our well-intentioned proposal. We met with a group of the Sharon Hospital Community Board comprised of 2 members of the Community Outreach Committee and the board chair, and our proposal was generally well received. Subsequent conversations with Rick Cantelli and Dr. Herco were cordial, engendering the expectation that our ideas would be passed up to Nuvance Corporate. After a subsequent inconclusive email exchange with Dr. Murphy, here we are. I live in Sharon. I have many friends and colleagues with young families from towns and independent boarding schools across the region who depend on a full-service hospital. FCH is a trusted community partner entrenched in the entire Sharon Hospital service area with important connections to the Berkshire Taconic Community Foundation. The loss of FCH as a Sharon Hospital partner leaves a void that Save Sharon Hospital can help mitigate. Our proposal is an affirmative attempt to enhance Sharon Hospital's community engagement for the benefit of all. And I hope that OHS will consider it with the same foresight you exhibited in creating condition number 2 in the first place. Thank you.
Thank you, Mr. Moore. The next person we have is Jill Drew.
Thank you, Ms. Mitchell. Good morning, everyone. My name is Jill Drew, and I also live in Sharon, Connecticut. I join with the other members of Save Sharon Hospital in objecting to the modification Nuvance request from condition 2, because condition 2 is the only regulatory requirement that provides a structure for ongoing outsider input into the hospital's governing apparatus. I hope that Nuvance would agree that it is valuable to have ongoing give and take discussions about the hospital's role in the community, especially as it is one of our largest employers, as it makes its corporate decisions. That was indeed the impression I got when I was able to meet with interim president Denise George and once with the current president, Mark Herco. We had friendly, frank, and fruitful conversations that were unlike the dynamics of the short Q&A periods during the hospital's twice-a-year community presentations. I believe the hospital would benefit by establishing a structure for regular meetings of this kind with local elected officials and other community members, separate from the whole board apparatus. Nuvance has argued that it has plenty of two-way dialogue. It has a committee to assist with its obligation to conduct a community health needs assessment every 3 years. It has recently established a patient and family advisory committee at Sharon Hospital, as there are in the other Western Connecticut hospitals, and I applaud that. And the structure of that committee could be complementary to the kind of committee we are seeking. And of course, it has the Sharon Hospital Advisory Board. I applaud all the board members and imagine that they do share the wisdom and expertise with hospital administrators, but it is an inward-facing group and it is unclear what power it has to influence corporate decisions. All board members have signed confidentiality agreements, so they have no avenue to independently communicate publicly about the hospital. This is a generous community that supports the hospital. Many of us not only contributed as part of that $1 million match fundraising drive that Dr. Herco mentioned last year, but also sprang into action when COVID hit. Members of this group helped organize the sewing and donation of more than 6,000 face masks in those first weeks when supplies were scarce, hundreds of which were delivered to Sharon Hospital pre-sterilized and individually packaged. We had to delay delivery, however, because we couldn't find anyone at Sharon Hospital to accept them, as other hospitals had already done, including Charlotte Hungerford. Local officials said they needed the corporate okay, and that took some time in coming. And a few weeks later, we organized local restaurants to prepare and deliver hundreds of meals to Sharon Hospital workers paid for by community members. And after our experiences with the masks, I reached out to the hospital board to ask if they could help us get approval. And I am really grateful to the 2 members of the outreach committee who were able to connect us to Nuvance officials in Danbury, who were able to approve our meal train plans. What we are seeking here today is simply a mechanism for this kind of two-way dialogue to become the rule, not the exception, so that when things get tough, and we know they will, there will be an enforceable requirement for hospital officials to have a real public dialogue. Thank you very much.
Thank you, Ms. Drew. All right, so the next person is Victor Jermak.
Thank you very much. My name is Victor Jermak. I've lived in Salisbury since 1984, and I've been very involved in preserving Sharon Hospital for our community first through the efforts of the community to save Sharon Hospital, and now as part of Save Sharon Hospital. I've been involved since the first sale to Essen in 2001, and now with Nuvance, its current owner. This is against a backdrop of hospitals experiencing extreme financial difficulty. And this is certainly true of Sharon Hospital today and Nuvance. And it's something that I think we as members of the community all have to be responsive to. How do we preserve our local hospital? And I want to say this, that OHS stated back in 2019, when we had a community meeting, and I quote, that the community engagement represented by FCH's involvement should continue unabated, and that the needs of the Sharon community would be heard and addressed following the merger. And that's exactly FCH's, that was OHS's feeling at the time. We now understand that Nuvance wants to change the nominating process for board members so that the board will be self-selecting and in fact, self-nominating. This is wrong and goes against all fair notions of what an openly selected board should look like, where the community has a voice and the board regularly and openly communicates with the public, which unfortunately hasn't been happening. An example of that is when maternity was going to be closed and threatened to be closed. Where was the board at that time? Why didn't they say something? If they truly represent the public interest, why wasn't there more dialogue with the public? Now, I'm an expert on best corporate practices because I'm the CEO of a company called Rate Financials, and we advise corporations and clients on their boards. And I will tell you, having open boards, having community representation is a very positive thing. Save Sharon Hospital proposes to the Office of Health Strategy some modest changes to the Sharon Hospital Board governance policy so that condition 2 will be changed by 1, that Save Sharon Hospital nominate a non-biased community member to the current outreach committee of the hospital board, and that 1 rotating public official on an annual basis from the areas served by Sharon Hospital shall also serve on the outreach committee. Notice what we're asking for. We're not asking for seats on their board. We are asking for seats on their committee, the outreach committee, which currently, as I understand, is composed of perhaps 2 members at most. We want to enlarge this and make real contributions to the community by encouraging open communications. 2, that these 2 members be entitled to participate in full board meetings where issues directly impacting the community's health are discussed. 3, that the outreach committee have at least 1 annual public community meeting. And 4, that Save Sharon Hospital shall have the non-exclusive right to nominate candidates to the Sharon board when vacancies occur. We don't consider these odious. We consider them helpful and constructive suggestions to make the board more effective and more responsive to the community. We had a series of discussions and perhaps some negotiation with the Sharon board and its chairman. And I thought we were making real progress. Unfortunately, Sharon Hospital and the Nuvance senior management really didn't want to get involved, and we couldn't build a dialogue with them. My feeling is that all of the people involved with this situation, whether it was the board or Sharon Hospital or Nuvance, are good, well-meaning people. And we would hope to be able to find a way to effectively have real communications and representation on this board through the outreach committee. We look to the Office of Health Strategy to restore real and effective board governance and improve communications with our community. I want to thank you very much.
Thank you, Mr. Jermack. Lastly, I think we have Lydia Moore.
Thank you. Hello, my name is Lydia Moore and I live in Sharon. Thank you for the opportunity to speak today. As one of the founding members of Save Sharon Hospital, I would like to start with a little background about how our group was formed. In July 2018, my life as a pregnant mother was turned upside down when I learned that maternity at Sharon Hospital would be closing in a month. I had been hoping to repeat the wonderful experience I had delivering my first child at Sharon Hospital, and I was terrified that I would not be able to survive the long journey to another hospital if I had a medical emergency. This inspired us to create Save Sharon Hospital in order to rally our community to encourage the hospital to keep maternity open. Our efforts proved successful. I was able to deliver my son in 2019 at Sharon Hospital, and hundreds of other mothers have delivered their babies in Sharon since then. Many of our group's members spoke at the OHS hearing regarding the HealthQuest and WCHN merger in December 2018. We were extremely concerned about the hospital's lack of communication surrounding the initial decision to suddenly close maternity. You at OHS listened to our concerns, so thank you for that. We are now concerned that if you grant Nuvance's request to simply remove FCH from its role in nominating board members in the CON, that our community will be even less represented by a self-nominating, inward-facing board that had previously agreed to shut down maternity despite its vital function in our community. We therefore ask that OHS prevent this complete exclusion of outside community influence on the hospital board by denying Nuvance's request to modify condition 2 as they have written. There must be better two-way communication, and this should be written into the CON. Our suggestion is that the community outreach, or one suggestion is that the community outreach committee of the hospital board should include elected officials from towns in the hospital catchment area. This would be a simple yet effective change. I would like to close by emphasizing that our group is made up of individuals who are heavily invested in Sharon Hospital. When Nuvance asked for donations to meet the $1 million challenge grant, many of our members contributed to this success. When the pandemic was reaching its initial peak over the summer, several of our members helped to organize hundreds of community members in a large mask-making effort for Sharon Hospital, as another one of my colleagues mentioned, as well as other hospitals and organizations. We organized a meal train for hospital staff, and we also helped to organize area schools to deliver inspirational artwork from community children to the hospital. I do not believe any of these efforts would have taken place if it weren't for members of our group. We put our love and hard work into these projects because we know that Sharon Hospital is vital to our community, and we believe the potential exists for a stronger hospital and community relationship. OHS, you have the ability to help us build this relationship by not permitting a modification to the CON without including real and meaningful changes. Thank you for your time and consideration.
Thank you, Ms. Moore. All right, is there anyone else that wants to give public comment that didn't have an opportunity to? You can unmute yourself and just let me know.
I'm Brent Colley. I'm the first selectman, and I stand behind everything that's been said. I think it would be a real big help. You know, I'll keep it that simple.
I'm sorry. Can you just state your name again, just for the record? I want to make sure that we got you for the purpose of transcription.
Sure. It's Brent, B-R-E-N-T, Colley, C-O-L-L-E-Y. Found the first slide.
Okay, thank you.
Okay, thank you.
Anyone else?
Could I make a statement? John Allen.
John Allen, okay.
I'm a pretty neutral observer of this because I've been here in the northwestern part of Connecticut for over 45 years, but I haven't been that familiar with what has been going on with Sharon Hospital, even though I think it's an integral part of the community. And just listening to the commentary on both sides, I was quite impressed by the expertise that both sides showed. And it would seem to me that Nuvance and Sharon Hospital would want to capitalize on the expertise of the people on the other side of the table. They seem to be very knowledgeable about healthcare systems and the medical environment. I'm a trustee of the John Hartford Foundation, which is the leading foundation in the United States, which is trying to improve the healthcare for older Americans. And so I've been integrally involved with the US healthcare system in that manner for over 12 or 13 years now. And I think it really would behoove New Vance Health and Sharon Hospital to, as I said, capitalize on the expertise of the people in the community. And those are my comments. Thank you.
Thank you very much. Any additional public comment?
This is Rick Cantelli. I just wanted to follow up on a couple of points that were made, and I think I have to speak on behalf of the board. That we would take offense at the notion that we are inwardly focused and not focused on the needs of the community, and that we don't represent the community. We have had many debates, discussions, pushback on both the HealthQuest administration, the New Vance administration, although certainly I think, as Dr. Murphy alluded to earlier, the relationship between not only the community, but the board and New Vance is an excellent collaborative give and take working relationship, which has not always been the case. And I think many of the comments made here today were made in the context of the previous administration, and things that were done, things that were said, and actions that were taken. And we as board members were caught up in that as well as the community was. So I think the comment that the board refuses to engage with the community has been demonstrated to be false, given all the discussions that we've both talked about today that have gone on for more than a year. I just want to provide a quick example of some of the nuances, because I agree. I think we have worked collaboratively. I've known some members of the Safe Sharon Hospital group for a long time, and I consider them my friends. And we want their input and we seek their input. And we had offered, and again, just as a couple of examples, we had offered that they would have the ability to recommend members of the committee or members of the board. At the end of the day, the request demanded that they have the ability to nominate a board member. We have a nominating committee of the board, and the board is representative of the community. We also had a discussion, and I may not have this exactly right, but Victor talked about that they would want whoever they appoint to or recommend to the community relation committee, which we're open to having a discussion about, has the ability to participate in all board discussions relevant to the health of everybody in our catchment area. Well, every agenda at the board is relevant to the health of everybody in our catchment area. So that's overly broad. So these are just two examples of sort of where we have progressed to. And although at the end of the day, I will say, I think we all want the same thing. And I tried to impress on the group that the board is representative of the community, and we want Sharon Hospital to be here. It is a challenge, given the financial circumstances, the location of the hospital, the volumes at the hospital, but we are not inwardly facing to New Vance or HealthQuest. I assure you, we are members of the community, and we voice our concern at every single meeting. Thank you.
All right, so I'm just gonna offer, I don't want a response so much to what Mr. Cantelli said. I'm just gonna ask if there's any additional public comment before I go back to attorneys Boyle and Duffy. All right.
Forgive me, and I just can't help but fully support Rick's comments. I'm Joel Jones, Rick's predecessor as chair of the board of the hospital, and just want to fully support everything Rick has said. We are absolutely members of the community. I'm on the board of finance in my town of Falls Village. I'm a volunteer firefighter here. We've been here almost 20 years now. I'm the Appalachian Trail maintainer in Falls Village. We are very much part of the fabric of the community, and my colleagues on the board all have their similar stories in that regard as well. So just wanted to confirm and support everything that Rick has said. Thank you.
Okay. Anyone else for public comment?
I'm Perry Farood. Hello?
Yes.
Okay, I am on the Sharon Hospital Board. I'm actually the vice chairman of the board, and I wanted to say that I live in Lakeville. Do you want me to spell my name?
Yes, that's actually
Okay.
what I was going to say.
No problem.
Thank you.
It's P-A-R-I, and then my last name is Farood, F as in Frank, O-R-O-O-D.
Thank you.
As I say, I live in Lakeville. I actually run a breast cancer foundation, so I can add not-for-profit to all the different the board, all the different occupations that the board has. We are a very representative board of our community. I had the pleasure and honor to work with Lydia and Jill, and they talked about how we got that meal train going. We were thrilled to do it. They reached out to us as members of the community. Yes, I'm on the board, but also as a member of the community. I'm an elected official in the town of Salisbury. I'm on the Board of Finance. I chair the Salisbury Affordable Housing Commission. I volunteer in every aspect I can here, and I feel like I know the community pretty well. My kids went to school here from the time they were little kids with Herbert Moore and Nick's kids, and I know all of these people, and we are open and representative, and everything that Rick and Joel has said, we're out in the community and very accessible. And the thought that we would be, inward just after our own particular interests, or not just Nuvance, spokespeople or something, is entirely wrong. We care about the hospital. We care about the people who work there. We care about the people who are treated there. My kids have been in the emergency room more than I can tell you, with broken wrists and broken arms. And we consider ourselves stakeholders, not only as representatives of the community on this board, but also people with a deep, deep care and concern for management and how the hospital is run and how it responds to the community. I happen to chair the QPIC committee, and there's nothing more important to me than making this the best hospital in our little community. As you can imagine, running a breast cancer foundation, I'm extremely aware of the fact that that healthcare in our community, and every community, needs to be responsive to the needs of the people. And we are, and our board cares, and we're from all over the community. And I just wanted to stress that we're, as I say, the board is community members. Thank you.
Thank you. I see a hand up from, it says Roselyn's iPad. Did you want to speak?
Yes, this is Robert Schnurr, S-C-H-N-U-R-R. I'm a retired physician from Sharon Hospital. I'm just a little confused about something. First of all, the current board makeup, which is actually excellent, was picked by the Community for Foundation. I believe they want to get rid of the people in that sense that has done a good job picking the board members. I understand the reason for that, but I'm just trying to think, there's nothing about the current board, but what about 10, 15 years down the road from now? Will it change tremendously? Will we still have the ability to pick the same quality board members? Not the ones right now. The head of the nominating committee is a close friend of mine. I would trust him with anything. But what will happen in 10 or 15 years? That would be my concern. Thank you very much.
Thank you. I see a hand up from, is it Lorna Broadcorp? I'm not sure if I'm saying it correctly.
Yes, you are saying it correctly. I don't know how to get my picture to be a picture.
That's okay.
And it's probably connected with the fact that I was born in Sharon Hospital at a point when most babies were still born at home. My children were born in Sharon Hospital, and I'm impressed today by the passion with which board members and community members are expressing their concern for the hospital and for the community. What I don't understand is why would the hospital resist the suggestion that it be required to have, for instance, elected officials on its outreach committee? We're not asking to take over your board. We're asking that you be required to remember us down the road when I'll be gone and my children and grandchildren will not. To require community representation on something called the outreach committee seems pretty innocent. And I don't know why you don't just leave that requirement in. That's all I have to say. Thank you.
Thank you.
Can I make a couple of comments?
Sure. Just state your name for the record.
My name is James Quella. I'm a resident of Sharon, Connecticut, and the chair of the outreach committee that's been alluded to multiple times. I had the opportunity to meet with one of the representatives of Save Sharon Hospital in my home during the period of time that we were going through the controversy about the maternity closure that was being proposed. And I was all ears. I listened for hours and exchanged a dialogue that was, I thought, very cordial and very productive. And I took it back to the board and expressed all the opinions and all of the concerns that were alluded to, and actually individually fought very hard in that context that this announcement and the way it was being handled was not effective. And a part of the input of understanding that was me meeting with somebody from the community, notably somebody who represented Save Sharon Hospital. So in no way did I feel impeded, inward looking, or in any way debilitated in carrying out my duties as a board member. I don't think it would have been necessary for that individual to be on my board or to sit on my committee or to attend every board meeting that had anything to do with community relations for me to fully appreciate, understand, and internalize that input. Save Sharon Hospital is a subset of the entire community and itself represents some group of people who are passionate and committed and no doubt putting a tremendous amount of time and effort, concerned about the community and its needs as it relates to Sharon Hospital. But they're not the only community members. And there are quite a number of other community members who have other gripes and other concerns and other issues about Sharon Hospital, which we're not discussing. And it would be a bit challenging for us to have every one of those groups represented as a group coming before you asking for permission to participate in a board. The board probably would consummate at some point far more than 13 people. Would I don't know how many people would have to come before we felt that we had as diverse a group as represents this community, which by no means diminishes in any way. As I said, I've met with various members of Save Sharon. Perry and I, working with the group, participated in getting the food, as was alluded to earlier. I personally contributed to that effort, both with my time and energy. And by no means did I feel obligated to do that, but I did feel the same sense of obligation that comes in supporting our workers at Sharon Hospital. As a governance matter, I sit on many public boards and I've been on many boards throughout my entire career. It is highly unusual for outside groups to demand positions in boards that are not a part of the normal functioning of a board. And I would find that to be an outlier, quite frankly, in the way in which boards work. To say a board is self-nominating is almost axiomatic. Every board has a nominating and governance committee, and every member of that nominating and governance committee is on the board. It's just the way boards work. the responsibility of the board chair is to look at the entire array of diverse candidates that are represented in a community, representing, in this case, Sharon Hospital, and to be deliberative and thoughtful about which nominations make the most sense, and to then go about their business of getting those nominated people before us in front of the board. You can't have a nominating committee, in my opinion, that is divorced from the board, because it's the board's itself understanding of the needs and requirements of that board that help that board function as a board. I'm most dismayed by comments that have been made today that were inward-looking, myopic, unrepresentative of the board, of the community, deaf-eared to the needs of the community, and that without added representation and a kind of a governance structure, which I find highly unusual, that this group of people would be continuing in a myopic, inward-looking way. I'm very deeply dismayed that those words have been said, deeply dismayed that they're believed, and deeply dismayed that they're the basis for the argument. If the argument were that we needed more diverse candidates, I'd be all ears. I'd be, in fact, strongly recommending our nom-gov committee to look at those candidates that could be recommended by anybody who is participating in this phone call today. But to have it as a reaction to the failure of this board to be a community sensitive, community listening, and community participating group, to me is just a thesis that I can't accept. And whether you decide one way or another, if that's the thesis upon which you decide, I think you'll have to hear from me a strong objection that anybody on this board doesn't do anything but listen to the community, but participate in community activity, but try to invite those people into our home and listen to their concerns.
Thanks, Mr. Quella. We're going to move on to Mimi Tannen.
Thank you. I'm also a board member of Sharon Hospital and also a board member of the Foundation for Community Health. And I was a member when Sharon Hospital was formed and we went through all the negotiations. So it's a few things that I want to say. First, referring to FCH, we recommended, according to the agreement, we recommended board members and HealthQuest nominated them. The Foundation for Community Health did not do the actual nomination of the board members. We gave a list to Sharon Hospital, to HealthQuest, and they chose from our list. At the time, we had about 100 applicants, resumes that were sent to us. We worked diligently for a long period of time. We interviewed, I don't remember how many in person, and we chose about 15, I think it was, I'm not clear the numbers, that we proposed to HealthQuest, and they chose out of those numbers. 8 of us are still on the board. I am on the Sharon Hospital board as one of those people. Our grant at the time, I think was about 5 years that we were going to be doing those recommendations. It was not meant to be in perpetuity. It was a short period, just while the hospital stabilized. At this point, since our grant agreement is separated, Foundation of Community Health is not interested in providing any more nominations. And I hope I'm not speaking out of turn now. I'm not the CEO, I am a board member. So I did want to say that. My background is Sharon has been since 1978 when I started working at the hospital. I worked there for about 20 years. I actually worked for Dr. Schnur in his office for 7 years and then moved to Poughkeepsie with worked for a not-for-profit in Poughkeepsie. And because I'm so familiar with the not-for-profit worlds that serve the needs of the community, I'm the chair of the Health Needs Committee at the Sharon Board now. There's no way that we're not involved in the community. I'm from Millbrook, and I bring that knowledge as well as my history with Sharon to the board and work with the agencies and with any community members that are interested in working with us. I am offended by the claim that we're inward looking and not interested in the community. And that's just a personal feeling. And I support what the other board members have said. Thank you.
Thanks, Ms. Cannon. Anybody else want to give public comment? Sorry, I cut myself off there. I want to thank everybody for, just talking about what their perspective is for the purpose of public comment. Again, we are going to leave the record open for 7 days to receive public comment via email, or you can mail it into the office. One other thing before I turn it over to attorneys Boyle and Duffy for closing is I wanted to mention that it'll come back to me. Let me just go ahead. Attorney Boyle, did you have a closing statement?
Yes, yes, thank you, Hearing Officer Mitchell. I wanted to say that, I think the board members have illustrated a lot of my points. I think this is a great group of people who clearly represent the community. This is a community board, as they've shown you. They are diverse, they're committed, they are involved in the community. And this is actually, going to change. It's not going to change. It's going to continue. This is a tax exempt nonprofit board that is obligated, by virtue of its charitable status, to ensure that it represents the interests of the community and that it acts in the best interests of Sharon Hospital, this corporation. And it is essential that these board members are are allowed to actually exercise their fiduciary duties and choose board members who represent this community and who believe in Sharon Hospital and can act in its best interests. And it is not the case that we are trying to foreclose community involvement at all. There's been extensive communications, including with the Save Sharon Hospital group, about to hear what they have to say and get their input, and that's not going to change. These folks, as you have seen, are committed to that. As is the management of Nuvance. These are folks who are stewards of these tax exempt assets and are committed to making sure that they understand their community and do what's right for that community. This, though, is a request for a straightforward modification of a covenant that is tied to the past. It's tied to the foundation grant, which is no more. You've heard the foundation folks mention that this was done mutually. We're all friends. We're still on these people are on each other's boards, and we will continue to do that. There are mechanisms already in place for community input beyond the informal ones, which have been discussed extensively, including the 2 public hearings that we have a year. And a lot of what you're hearing is tied to the past and when this was a for-profit entity. That is no more. This is a tax exempt entity, and it's different. We have different stewards, we have different people in charge. And to the extent that there are changes in the future, as there likely will be, as with every healthcare institution, that involve services, then there are mechanisms in place currently for addressing those. There is a right, there will be hearings. The CON laws protect and provide investment and discourse on those issues, and those will continue to exist. And so that's the mechanism for addressing changes and coming forward with regarding any changes. But this board has said that they are committed to listening, to having open doors, to even looking at candidates for committee membership or board members. What we don't want is to legislate that in a CON by an unreasonable provision that would involve, for example, as suggested, public officials. This is not a public corporation. It's a private tax exempt entity. Those folks have a forum for their voice. And what we want is people like the ones you've seen, who are true community representatives who can speak to their use of the facility, what they see in their community, and that represent a diverse set of interests. The condition that we're requesting, the change, is actually similar to it's exactly what every other corporation, every other hospital board has in their CONs. All we're asking is to be treated equally and fairly on that, to actually be, have the same requirements as everyone else. Progress has been made in the communication with the community. It will continue to be made. We're committed to that. I respectfully ask that OHS grant this modification request, which is reasonable and fair for this community and Sharon Hospital. Thank you.
All right, thank you, Attorney Boyle. So at this time, we're going to go ahead and adjourn the hearing. I take that back. We're not going to formally adjourn. We're going to end the portion for public comment. I have to take that back too. So what's going to happen next is I'm going to actually stay on. Counsel for the applicants are welcome to stay on, but because in our announcement we said that the hearing was going to last until 2, I'm actually going to remain on Zoom with my camera off, and I'm also going to mute myself so I can do some other work in case there are other people that want to come and render public comment. So I'm going to be on for the next 2 hours, and then at 2 o'clock we'll adjourn. I also want to mention and reiterate that if anybody wants to submit a written comment, they can do so by February 23rd of 2021, and that will be included in the docket. I thank everybody for their time. You're happy. I'm happy to have you stay as long as you mute yourself. You can keep your camera on, you can turn your camera off, but for me, I'm going to mute myself and turn my camera off. Every 15 minutes, though, I will come on to see if anybody has a comment that they want to render, and I'll also be listening in case somebody pops on and in between those times. So we are pretty much done for today for everyone that wants to log off at this time.
Thank you.
You're welcome.
Thank you, Michaela.
You're welcome, everybody. You're welcome.
Thank you, Michaela.
Michaela, can people that have already spoke add anything to their public comment, or are we limited to our initial 3 minutes?
Nope, you can add to your public comment.
Thank you for that. I just wanted to respond to a good point that some of the board members have made about their dedication to the community. I think it's absolutely valid. As some of you noted, we've known each other personally for 30 years, and I respect what you do, and I respect what you've done at Sharon Hospital. I think in making the point about how decent and community connected you are, you make the point that we ourselves are making, is that the current process has led to a board of this strength. It's led to having all of you there to advocate for us. And what we're concerned with is a change in the process without any substitution or discussion of a mechanism that may be comparable that could potentially lead to different board members who are not as strong as you are. I certainly hope that nothing I said or anybody, well, I don't want to speak for anybody else, but I certainly hope that nothing I said came off as our being critical of you personally. What we are genuinely concerned with is a change to the process that would lead to, or could potentially lead to, board members who are not as strong as you are. Thank you.
Thank you. Anyone else? Okay. So I will still be here and within earshot, but I'm just going to go ahead and mute myself and turn off my camera. I'll be here until 2.
Hi, it's Brent Cully again, First Selectman. Just, as an understanding, I think of what Save Sharon Hospital was asking that may, kind of got twisted was when I started in 2013. I was, as an appointed member of our town, on a board that had the ability not to do anything with the hospital at that point in time, but we sat on an advisory board and we could basically share information with the hospital that we learned just because, everyone talks to us. That's the simplest way I can put it. And, we met like once a month, or, if we didn't have, a decent amount of information to give, it was every couple of months. And I think for the hospital at that time, it was helpful because, we could share with them maybe some things that they weren't aware of. And it wasn't like we were trying to control anything. It was just kind of just information being shared. And obviously a lot happened between 2013 and, into the present. So I think like what the Save Sharon Hospital individuals that spoke were speaking to was that, whether it be me or Curtis Rand in Salisbury or Gene down in Kent or whomever in our local, area, because, Sharon Hospital serves all of us, we could provide some information that they may not have had if they hadn't heard from us. So it's not really a control thing. It's just kind of like a sharing thing. And Dr. Herco has been great in reaching out to me along the way since the transition to Nuvance. And I think that's just the thing is just we want to be able to like help the board. I don't get any feedback from the board itself. I know people because I know their spouses or I know who they are, but I have never spoken to these individuals on the board. And I mean, outside of Mr. Jones, because I knew Felicia, his wife. So like, if they check in with us or they reach out to us or we can reach out to them, and I can do that, but still, I mean, when you're a first selectman, you're juggling so many different topics that, unless it's put to your, frontal lobe by a resident, you just don't focus on it because there's so much to manage. We don't have town managers. We're not a mayor. There's no deputy mayor. We're juggling a lot. And to have a hospital in our town is great, and we want to help them. There's nothing negative really here at all. It's just we want to help. We want to be a part of the process, and it doesn't have to be me. It could be anyone serving, and I get it. Like, no one likes a politician, but a lot of us aren't your typical politicians. We listen and talk to so many people. I can't go to the store or Extra Mart, which is our gas station, or the post office without talking to somebody about something. And that's what we kind of want to do is just make sure that the board, whomever they are aware of what's being talked about. And I think we can help. And that's the ask, really. It has nothing to do with anything that's wrong or right. It's just that we have some information that they could never have. And that was what was so great way back when we had that advisory board. We had no control over anything that the hospital, could do or did, but we could share with them some things we heard, and then that would help them be like, oh, wow, I was not aware of that, because, think about it. When you're an elected official, you have access to every single resident in your community, but also so much that's going on in your community, which deals with everything from ambulance to fire calls to, basically most of us that live here, I'm here because my wife got a job with a local orthopedic office. So I would not be here if not for the hospital because that's where she does surgery. So we have an intimate knowledge of the hospital that others don't have. And I think, days like today are tough because, people get defensive, but I don't see it as, anything negative. I'm just saying like, we could help and we want to help, and if they don't want the help, then that's great. But that's it. We're here to help. And we just want the capability to help moving forward. But again, if no one wants help, then that's cool. We're good. All right. So I'm Brent Colley. I'm the first selectman of Sharon, Connecticut. And, that's my final testimony. And thank you so much for, doing this. I mean, this is a big help for everyone, and we appreciate it.
Thank you. All right, just checking in to see if anyone wants to render public comment. I'll check back in within about 15 or 20 more minutes. Just checking in to see if anyone would like to render public comment. Thank you. I'll check back in about 20 more minutes. Just wanted to double check. I thought I heard feedback from Jesse Fortas. Fortas.
Yes, sorry, I just had jumped on and just didn't mute myself quick enough.
No, no worries. Did you want to render public comment?
Oh, no, no, thank you.
Okay. Just checking in to determine whether or not there's anyone that wants to give public comment. Please let me know. I'll check back in at 1:23. Checking in to determine if anyone wants to render a public comment. Thank you. This is Michaela Mitchell again. This is the last time that I'm going to come back on and ask if there is any public comment to be rendered in this matter. Otherwise, we're going to go ahead and close at 2.
Hello, can I just make my statement? Is that how this works?
Yes, ma'am. Just state your full name and spell it for me.
Okay, sure. My name is Deborah, Deborah Moore, Moore. Look at all these faces popping up suddenly.
Okay, Ms. Moore, if you want to make your statement, you can. Uh-oh. All of a sudden you're muted.
I was just holding the space bar down. I stand in support of keeping the community and engaged in the hospital, in the corporate ownership of our hospital, and through a liaison of an elected official. Okay, do I need to do more than that?
No, no, ma'am, unless you wanted to say something else.
Just sort of curious at I do think it would be nice if the hospital board and the community we're able to engage with a local official at the very least. I know there's a lot of animosity, but there doesn't need to be. Okay. Hi, everyone.
Hi. Thank you for your comment. Anything else?
It's a weird one-dimensional thing, this Zoom thing. Hope you're all well. Stay well. Appreciate the care that all of you healthcare people give us. Thank you. Be well.
Thank you. Anyone else want to give public comment? All right, so we're going to close at 2 o'clock. I'm just going to leave it open. If anybody comes, I will have my ears open.
Thank you, Michaela.
You're welcome. All right, everybody, this is the last call for any additional comment, public comment. All right, so the time is now 2 p.m. We're going to go ahead and adjourn the hearing. The record will be open for written comment for 1 week. And after that, the record will be closed and we will be drafting up a decision. Thanks, everybody.
Thank you. Michelle and Brian. Take care.
Thank you.
Bye-bye.
Thank you, Attorney Mitchell.
All right, have a good day.
Thank you.
Yeah, I wish I'd stayed on that too. That was interesting.
One thing I thought was interesting, I don't know if you guys, like, I actually wish I in real time adjusted what I was going to say is they were almost making our point for us.
Yes, absolutely.
We're also community connected. We're the most connected people in the entire community.